In the Amhara region of Ethiopia, persistent food insecurity and malnutrition are daily realities for millions of people, and these crises do not affect everyone equally. Women of reproductive age and children under 15 bear the heaviest burden when food systems falter. Ethiopia actually has robust national food and nutrition policies on the books, but for years, those high-level commitments failed to translate into reliable support at the regional level. The disconnect comes down to resource access and decision-making. Malnutrition is tightly linked to gender inequality, yet the regional governance systems were completely blind to this overlap. Historically, gender inclusion in Amhara wasn't treated as a shared government responsibility. It was treated as an isolated task. The entire weight fell on a single entity, the Bureau of Women, Children, and Social Affairs. They were expected to manage gender equality alone. Without cross-sector rules like health, agriculture, and finance could treat gender inclusion as an optional suggestion. This isolation meant sectors handling food and health lacked the dedicated staff, standard procedures, and crucial budgets required to prioritize women's needs. As long as equality remained an unfunded recommendation left to a single bureau, the root causes of regional malnutrition were impossible to address. In July 2023, the CASCADE project launched a regional gender audit to figure out exactly where the food and nutrition policies were breaking down. Looking at these administrative records, the audit provided hard proof of massive gaps in planning and budgeting across 5 regional bureaus. The lack of standardized data meant there was no reliable way to track whether nutritional services were actually reaching vulnerable groups. This concrete data forced the issue. It turned abstract complaints into an actionable, documented crisis, bringing bureau heads, planning experts, and community groups to the table. The audit made one thing clear: structural problems can't be fixed by individual champions. They require legally binding solutions. The Bureau of Women, Children, and Social Affairs was already working on a regional directive. So rather than starting from scratch, the team fused the audit's findings directly into that existing draft. During the consultation phase, community organizations, women's associations, and disability groups weighed in, shaping the exact accountability requirements based on their daily realities. The draft then went through an extensive review. 38 different regional bureaus contributed their inputs, and the Justice Bureau combed through the document to ensure it had strict legal enforceability. After 19 months of meticulous drafting and alignment, the Regional Council officially endorsed Directive 56/2017 in February 2025. Issuing this as a directive rather than full legislation was a strategic choice. It bypassed a prolonged legislative process, allowing the rules to be operationalized immediately within the existing administrative framework. Through this process, community evidence was successfully translated into an inescapable, region-wide legal mechanism. This created an entirely new architecture for the region. The solitary bureaucratic effort was replaced by a system of shared, mandatory governance. The scale of this new architecture is massive. Directive 56/2017 legally binds 38 regional bureaus and local administrative structures. This mandate forces sectors to act. Departments like agriculture, health, and finance are required by law to allocate budgets and operational plans for women's needs. By institutionalizing this across the entire regional government, gender equality is no longer a polite request. It is the baseline rule of operations. The human stakes of this structural change are profound. The mandate guarantees improved targeting and delivery of nutrition, health, and agricultural services directly to the people who need them. Because it applies to every major public service touching daily life, this governance reform indirectly impacts more than 15.5 million women and children. And crucially, the government system itself, not external aid organizations, is now permanently responsible for tracking gender-focused outcomes using standardized metrics. The rollout is actively moving forward, with orientation workshops solidifying these strict duties down to the local, zonal, and Wareda levels. By embedding legal accountability directly into the DNA of regional governments, this directive redesigns the system to actually protect all of its citizens.